questions from people about the work that was done for the hospital committee. We held several meetings and tours and different things that Tom was going to talk about, and I asked him to come up and give a presentation on that because he was the go-to guy on that and had all the information and contacts and all that stuff. So he said he'd put together something tonight and then be able to answer questions from the council. So.
Good evening, thank you. As the mayor said, I'm Tom Weber. I'm with Stroll Architects.
Can you hold on, excuse me for 1 second. It was also mentioned that there was not any information ever brought to the council, and going over the notes, I would actually dispute that. Actually, you and Rodney Lamberson did come to the council and give a presentation maybe a year
November
or so.
11th, right.
Yes. So that information and the community meeting and all that stuff actually was presented to the council. So there are minutes. I didn't have the date, but I'm glad you got it. So go ahead.
Okay, thank you. What I did do in anticipation of tonight, I did put kind of a packet together. I have one hard copy, but I have an electronic copy on a thumb drive in my pocket. And if Mrs. Bird wants, my intent was to have you download it and distribute it to all the council members if they're interested in receiving this. Essentially, I was going to give just kind of a verbal report and then look for maybe some comments and some direction. To kind of recap, as the mayor said, in July, August, September of 2014, there was a lot of discussion in the local community about the future of healthcare in the Arcadia community, looking at kind of a grander, larger area. Much of it was focused on what was going to be happening with the old hospital, the old clinic. There was discussions and there was information that was kind of floating out that Franciscan Scamp and Mayo in their partnership, and then in the whole transition to Mayo, that the hospital and the clinic that was currently being owned and operated in part by Mayo was going to be closing sometime soon. As a result, there were a number of meetings that were held here with different community stakeholders. I see lots of faces in here that I'd met with during those conversations before we brought together this large community summit on November 10th of last year. As a result of that, then, as the mayor said, on the 11th, on the 9th, 10th, and 11th, Rodney Lamberson came from Youngstown, Ohio. Rodney's an architect with our Youngstown, Ohio office that specializes in architectural design and programming for clinics and hospitals. Rodney came here essentially under the agreement that just his expenses would be paid, no time, no professional service contract or anything else was ever entered into. So essentially Strollo, in an attempt to kind of allow us to maybe expand our relationship building with the city of Arcadia, we use it as an opportunity to kind of learn about the community, gain some information about what was going on in this community in way of healthcare. See if we could provide some professional services to help maybe guide you through maybe next steps in your community's plans for healthcare. So since that time, in December of last year, there was authorization for me to contact Mayo and explore what was going to be happening in the clinic and the hospital. And at that time, Mayo was open and willing to maybe have some conversations with the city about the future of that building, what may or may not happen, and they were really non-committal. Okay, that's the best way I can say it. There was also some direction and requests for me to contact Benedictine and find out what might be happening to the property they had over near 93 and 95. That resulted in lots of phone calls there, and I never was able to speak with anybody who was authorized to talk to me about what might be happening to that property. Now, as all of you know, I'm sure, May 29th, it was reported in the Tribune that Mayo bought the property from Benedictine. Just last week, November 7th, 6th and 7th, the La Crosse Review, of course, published articles saying that Mayo sold the hospital and clinic to Ashley, and their plan is to make executive office buildings. So it was really an opportune time then, because we've been kind of trying to figure out where do you want to go and what's going to happen with that clinic, what's going to happen with that hospital, where does the city want to move with their planning for community health care. Mayor asked if I could come in and just kind of give a synopsis. I have this written kind of memo on what we did, where things are. There's lots of attachments from the work that we did last year, including the minutes from that city meeting from November 11th. So again, I wanted to leave that, but essentially what I wanted to do was take this as an opportunity to find out and report that what we had heard, the needs in this community, or the desire and wishes of many different people, were some urgent care or emergency room services, nursing home services, and then perhaps maternity and obstetrics. Those were the three high areas of interest on things that are not likely to be provided in the very near future here in this community. They had previously been provided, they got kind of shipped out into lots of different areas. There's been lots of questions about what's happening in the licensing with those nursing home beds. There's all kinds of things that are still out there kind of pending on that whole nursing home issue, but I wasn't sure where the city wanted to go. Again, we're not underneath any kinds of a directive. We're not under a professional service contract with the city. I'm not in a position where I can go and kind of continue on my own to explore things without getting the direction of city council or somebody from the government here that says, we'd like you to look at this or this or this. Essentially, the task that we had last year is kind of unraveled and made its own course with the clinic being purchased by Ashley, the clinic and hospital. And, you know, I'm not sure where city council wants to go with this. If there's other areas you wanted to continue to explore, or is it just kind of wait and see what happens now with everything else? Mayo does not plan on operating any urgent care. When I talked to Dr. Tim Johnson, he said there may be a possibility at some point that the clinic, the new clinic, is going to be developed in 2 phases. That part of the second phase, they may look at some extended or longer term hours. That might be something like a walk-in. Of course, that's not urgent care, that's not emergency room. Those were the kinds of needs that we heard during the healthcare summit. So it sounds like a lot of the things that we heard that were maybe on the wish list for some of the community residents are not in the plans for any of the current providers in this community. So with that, I guess I'm looking for some comments, some direction on what maybe you would like to do for next steps.
When you talked to Mr. Tim Johnson, the doctor, right?
Yes.
Was he given numbers on emergency care? What was brought up to the emergency room? What was their thinking that they said no right away? What was their thinking?
He didn't elaborate on that. Essentially, the message that I kind of took away was that the market, it was not profitable for them to provide those kinds of services here in this community. Those being nursing home, maternity, obstetrics, and emergency or urgent care. That it was not going to be profitable for them to provide the services here. Accessibility to those kinds of services, I know that was one of the concerns that the community talked about. It's a long ways to go for emergency services here.
So who was in that conversation with you and Mr. Tim?
Just
Just you and
he
him?
and I, correct.
Okay, so, okay.
I think one of the big misunderstandings or misrepresentations in the community is that this is a city council or mayor-driven project. And you met with the stakeholders, many of them outside of our meeting at the high school, independently of anybody from the city. And I think that it's important that that be represented, that it's absolutely a community stakeholder meeting that you had. And can you just give an example of or some examples of people that were there, and the dynamic of the fact that it was a community meeting, not a city?
Sure. In fact, I do have a sign-in sheet. Don't want to embarrass anybody by giving names, but I'll indicate what their organization were that they represented. There was the City of Arcadia, Nelson Global Products, Arcadia Ambulance Service, several people actually from there. Achieve Sports Medicine, Trempealeau Community Healthcare Center, BAIA, Strollo Architects, of course, Costner, Coslow, and Brule. Is that correct?
Revolve. And
Okay.
just for the public's information, BAIA is our benefit advisors, our health insurance group with Jerry Denboer that was up here for our employees' health insurance.
School board, there were interpreters from the healthcare providers, Spanish interpreters, Christ Lutheran Church, TCHCC, must be Trempealeau County Healthcare Center,
So,
Arcadia Public Library, and again, more from Trempealeau Community, or Trempealeau Community Healthcare. Those were some of the people that we had met with individually, and also that attended the healthcare summit.
and then I believe you also got a chance to tour a couple of the employee clinics.
Right, we did do the tours of Ashley's clinic and also of Golden Plum. And while Rodney was here, we were able to secure a tour even though the hospital was empty, vacant. With the services of some community members, we were able to kind of sneak into the hospital and clinic and get an authorized tour actually with the maintenance department. And Rodney was able to kind of really look at some of the structure and the design and look at, just to kick around some ideas as a potential to adaptively reuse that building, expand the use of it, diminish capacity, all kinds of those issues were kind of brought out during that tour. Because at that time it was looked at, without doing a comprehensive engineering analysis of that building, because that would take a significant amount of time, and also the expertise of a lot of engineers and other structural experts, so that would cost you money. Was that hospital capable of maybe some adaptation for some other need? And of course, Ashley has since decided it is, and it can be executive offices, so that's kind of, sounds like that's going to be the future of that building. So I guess Strollo is, again, not under any contract with you. We are looking at, maintaining some kind of relationship. We'd love to do business with you, don't get me wrong. We're willing to continue to provide some free professional services. Strollo's got offices around the country. I happen to live in La Crosse, and I'm a one-person office in La Crosse for Strollo. I do the planning. I'm not an architect. I'm a planner. And so I work with architects. I do programming and planning for how functions and operations kind of fit, and then that gets translated into the physical design of structures and facilities. And so what we do as one of our marketing strategies is we reach out to a lot of different communities or individuals or corporations, and we do provide some services free, and it gives us a real advantage. We know that in the government world, everything's got to go out to bid, everything goes out usually under RFPs and everything else, but what it does is it gives us a real knowledge base on different needs for our potential clients. So it helps us in the long run secure business down the road, maybe not only in this community, but in other communities that have similar things going on like Arcadia does. So we use it as an opportunity to expand our potential business somewhere down the road. Again, we're more than willing to act on the behalf of the city if we're asked to. We're more than happy to engage in any kind of other activity or assessment, examination of current issues if there's something that's out there. But at this point in time, we had this focus on the clinic and the hospital, and that appears to kind of taken its own course now. So whatever, I guess it's out for discussion and conversation, and again, Strollo's willing to help with it, if asked.
Comment. It seems like you say, the situation has taken its own course. And I look at it now, I sure would love to have some facility here for emergency and all that sort of thing, because otherwise we gotta go to Whitehall, that's the closest. And we have learned to do that, cause I've had a bee sting thing, I had to go up there and all that, my wife had a broken leg. So the idea has come down to, we've gotten used to probably going other places. So what sort of a need do we have here? Yes, we want, but what sort of a need? So that would be something you could address, is that, the way I'm looking at it then perhaps?
Yeah, we had attempted, now, and Dr. Johnson, when I did meet with him, he did offer, he had indicated that if there was something that the city would request, he'd be happy to try to accommodate that request. He indicated if that's in engineering and maintenance, when we were talking about the building, or if it was something as far as a data information request, which is one of the things that we had looked at. We did receive some advance information from the ambulance service, from the Arcadia ambulance service, initially when we were here a year ago, and looking at numbers and types of calls and things like that. But of course, that's only one possible component of how patients come into an emergency. I mean, there's lots of walk-ins, there's lots of other services that might be able to bring it in. Of course, they may, the ambulance service that they serve may not cover all of the areas that might come to another emergency center or trauma center. So, you know, there are some things, if there is a specific data request that is out there, we can look at creating something, sending it on to Mayo and reminding Dr. Johnson of his offer to provide information.
How many physicians will be at the new clinic?
I'm not sure, of course, you'd have to ask Mayo that, I really don't know.
Well, that was one of the things that we have a meeting with
Oh.
Mr. Tim. If we've got doctors on call, there's no reason that that's just that's my thinking. We've got them on call, they're here, that's good for them.
Okay.
Well, I thank you for all the time that you put in. It was frustrating to, not get advancement on the acute care and the other types of services that we wanted, but you guys were very accommodating. In 2014, our family vacation took us through Ohio on our way to Pennsylvania, and I can say that your colleagues in Ohio, we detoured and they provided a tour of the St. Elizabeth's Hospital in Youngstown, Ohio. And while I was touring that, Cindy and the kids got to go hang out at the YMCA and do some swimming and table tennis and stuff. And St. Elizabeth's was beautiful, and just learn about that facility and how it came about and the types of services, the neonatal. I was blown away by just the types of cases that they handle up there for neonatal, and these little 1.5-pound babies that come in and what they're able to do with them. So, not just what you've done, but also the folks in Youngstown, I appreciate their accommodation and.
Sure. Again, if there is something that you want, I mean, we're happy to kind of follow up on it. I'm not sure where things are going for you as a community right now, so.
Well, we're blessed to have the Mayo edition, the new clinic, and it's great that the former St. Joseph building is not going to be sitting empty, because the last thing you want is a community landmark like that sitting on mothballs. So to have tax base and to have good jobs and everything, that's a blessing for us.
As far as my documentation that I brought, I've got the one hard copy. I'm happy to, I don't know where.
I would ask you to give that to Angela and attach that to our minutes as a matter of public record, please, Mrs. Berg. And we'll approve those minutes at our next regular meeting.
And if you would like, I'd certainly send you an electronic version that you can distribute to whoever you'd like.
Do you have that,
I do have the thumb drive on me. Sure.
line?
Thank you.
Do it now?
Thank you, Tom.
Thank you very much.
Well, Mrs. Berg is gone, we don't need her for this. Number 5 on the agenda, board and commission updates, none, we can move beyond that. Department updates, it says none, we can move beyond that. And public hearings, it says none, so we can move beyond that.
Just gonna pause you guys and switch